Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Director of Professional and Community Education. Today, I am so pleased to have Dr. Donna Seibert with us today from alongside Medical Ally. Donna, I'm so thrilled to have you here.
Mary, it's my privilege to be here.
Thank you. So tell the audience, we're going to talk about alongside Medical Ally, but please tell us a little bit about yourself first.
Well, I've had a varied life. I started out in nursing, and I really enjoyed it, but it wasn't the best fit for me. And I went to medical school in University of Cincinnati, and then I did my internship in internal medicine, but I ended up in radiology. So I did adult radiology and then pediatric radiology.
Wow,
So I've covered a lot.
Very impressive. Yeah, so you have this business alongside Medical Ally. Tell us about this.
I have been doing advocacy for over 30 years, but very informally. And then 2.5 years ago, I started alongside Medical Ally. And it is just what the name says. I come alongside of you, and I am your medical ally. Even though I'm a physician, I don't diagnose and I don't treat. I come alongside of you and I help educate you. I help you vet different physicians. I can go to the doctor with you.
Wow, that is wonderful. I'm going to tell you, and I think more than ever, and I don't know if you agree with this or not, Donna, but healthcare is complicated, and I think it just gets more complicated. And I truly believe that nowadays you need to have an advocate. You're really, whenever you're navigating this healthcare system, I think that people have to have somebody by their side. And not everybody has family available, but they certainly, again, now they have a physician who can be by their side. How great is that? So what are some of the things? Talk about some of the things other things that you cover, in the work that you do, and what other services that you can provide for people.
Well, part of what I love about this field, it's only the advocacy as a field has only been around for about 10 years, but we get to do quite a bit. I don't just handle the medical issues by talking to the doctors, helping to explain the disease process, and helping the client to understand their options, but I can also connect them with all these resources that I've met these lovely colleagues in different fields. So if you needed a home health care person, I could help you with that. Wow. If you need someone to help you find a place for your mom or dad, I could do that too. And I'm not limited just to the elderly. My clientele right now goes from 4 years old to 88.
Wow. And I was going to ask you that in terms of, so there's no age requirement.
No.
You serve all individuals. Wow, that's great. How about geography?
I'm centered on the North Shore, but I have to say I have clients down in Scituate all the way up into New Hampshire.
Yeah.
But I try to stay on the North Shore.
Wow, that's great. How do people know? Like, how do they know how to get a hold? Because this is wonderful. People don't understand that you're even out there and available, because I know and I see people struggling sometimes, needing to have this type of support, and they wouldn't even know. How would they find out about you? How would they know what you do and that you even exist?
Well, I'm very thankful for this program to help get the word out there about advocacy. But there are websites. I have my own website, so if you put in advocacy, I should come up.
Okay.
But you can also go to an organization called the Alliance for Professional Health Advocates.
Okay.
And they have a directory of different advocates nationwide.
Wow.
And all you need to do is put in your zip code.
Isn't that something?
There's also a local group called MAHCA, M-A-H-C-A, which is the Massachusetts Local Advocacy Group.
Wow.
And then there's also a national one, advocacy group. They call it NAHAC, or NAC, N-A-H-A-C.
Wow, isn't that great? Again, didn't even know that, and I've been in the field a very long time, and again, this is something really new and interesting for me, again, to hear of all of these groups out there, because this is something that's so important to people. So, when do people know? Like, when is a good time for them to reach out to you for this kind of support?
Well, I think of it as life is very stressful, and I don't think there's any more stressful time than when you or your loved one is ill. The stress level goes way up. Ideally, people would contact me before they get to that point,
Yep.
when maybe a parent is, you're starting to see some changes, and maybe you can't be there with your parent all the time. And maybe the parent's going to the physician, but you don't know what's going on because the parent can't tell you afterwards. So that's a large part of my value there. But it's any time you're not sure what's going on in the medical system, or you're not getting your questions answered, or you're not finding the physician that fits you.
Sure. Well, that's great. And also, some people might even be able to go, but they're not really able to comprehend some of the complications of the terminology and some of the issues that go on with a particular disease process and all. And you can help to sort that out too, it sounds like.
What I've been doing is I will, depending on what the client wants,
Yep.
but I can accompany them to the physician.
Yeah.
They don't have to worry about not remembering everything the physician has said.
Yeah.
Not only will we talk about it afterwards, but I will write up a summary, and if allowed to, I will even distribute that summary to their sons and daughters.
Wow. Isn't that great? Yeah, again, I'm a firm believer that nowadays in healthcare, you got to have that other person. Whenever you hear when people go to an appointment and sometimes they're hearing information they're not even expecting to hear, that they're having a serious illness or what have you, and people they hear that and they shut down. And I truly believe nobody should have to hear any of that kind of information without having another person by their side.
And I agree. A lot of people have someone that could go to the doctors with them. Take notes.
Yeah.
And come with questions.
Yes.
Because the doctor only has so much time with you.
Right.
If you bring your own agenda, write down your questions, you'll get through your agenda. Otherwise, I think the physician interrupts, they said, within the first 10 seconds.
Is that right?
Yeah, it's a very short amount of time. And they're rushed.
Right.
So, it's understandable.
Yeah.
But they have their agenda.
Right.
But you need to make sure that your agenda, your questions are answered.
Yeah, and I do think that happens a lot where people are going and, they're coming in and they're worried about something they don't even get to because it takes that different track like you're talking about. And I think that's hard for people. And then they leave the appointment feeling like, it didn't go the way they needed it to. And they're still left with worry and concern because they didn't have what they came in for addressed.
I have found that people can accept any diagnosis, even a serious diagnosis, and they can handle it. What they can't handle is uncertainty, the unanswered questions.
Yeah.
That's what makes many people anxious.
Oh, I agree. Yeah, absolutely. So that's great. Now, do you go to them or do they come to you?
The way I work it, usually they give me a phone call.
Okay.
And in the first 15 minutes, it's usually about a 15-minute phone call, we discuss what the issues are for them.
Okay.
And I decide if my skill set is a good fit for them.
Okay.
If it's not, I refer them on to someone else. I don't leave them hanging.
Yeah.
But if we decide, yes, we could work together and let's explore this further, then I meet them face to face and I take an in-depth medical history and I write up a medical profile for them with all the pertinent medical information that they need for any appointment. But at the end of it, I put down an action plan. Here is what I think you should do. I then meet with them a second time and say, okay, here's the action plan. Do you agree or not agree?
Yeah.
And would you like to do it yourself or would you like my help to do it?
And that's great too, because I think some people, again, they're so immobilized by a health issue, they don't even know what to ask. And I see, listen, even being in the field, when it hits you personally, you're not a healthcare professional then either, so again, it hits you and sometimes you just feel immobilized and you don't even know what to ask. So this is wonderful that you kind of formulate that plan for them.
Well, part of the value, I think a large part of the value of having an advocate by your side is that the son, the daughter, the parent can be just that. They don't have to be the medical person too.
Yep, absolutely. Yeah, and it is hard to juggle both hats, you know, because it just doesn't work that way. And there's the emotional content, which puts you in a whole different light in terms of how you're approaching a situation. Absolutely. So how long do you stick by people? Like, how long do you follow them? The frequency of your visits, all of those, or your interactions?
It depends on the clinical situation, but for an older person, I may follow them for years, and I have. If it's a short, just one issue that they need to have solved, it could be as short as a couple of months.
Yeah,
It's
wow.
whatever they need.
Yeah, so there's no set, How does it get paid for?
Well, the value is that you can actually save money with an advocate. It is out of pocket, and I don't make any excuses about that. But you actually save time and you save money. I have been to doctor appointments with clients, and the physician probably doesn't know the client as well as I do, because at this point we have a relationship, and they'll start suggesting exams that they would like to do. And I'll gently ask, okay, so for this exam, what do you hope to find with it? What information are you looking for? And after they tell me that, I ask the client, okay, if you found this out, would you do anything about it? Sometimes the answer is no. So then, I had one person who was scheduled for an exam, and I asked the physician, well, will this change your treatment for this person? And the answer was no. And I knew this was a pretty painful exam, and boy, was that client happy.
Wow, yeah, and they don't know that. So
They
again,
don't
so
know.
because a lot of times, as you mentioned, people never, there's so little conversation that you can even get in there, but a lot of times they might suggest something without going into the details on what does really the test entail? How invasive is that? All of those things. And with your medical background, it just brings it to a whole different level.
And that is part of the beauty. I can sit down and explain to them what those exams are, and I'm more available than their physician. They don't have to go through 3 layers to get to me. If they have a question or concern, they just call me up.
Do you feel like you get contacted more by the individual themselves or by families calling you in?
That's a very good question. Many times it's the family. I have had some older individuals who have had an issue and they've called me directly. But many times it's the family saying, I know mom and dad need some help and I can't be there for them. But yet I want them to have the help they need.
Do you often find that it's because of long distance caregiving that the families, because it's the way of the world right now, right? That we're not living in the same home next door or a mile away. Now we're separated geographically from family members. There's more distance because of life circumstances, jobs, all of that thing. So do you find that that's part of that or all of it?
I see it in 3 ways. One is if I'm working with, like my one client is a 5-year-old child. The parents are local, but they need some help understanding what was going on. For the older individuals, sometimes their son or daughter has a very high-powered job. They can't take the time off to go to the different visits they would like to. They don't have the time. Or they're far away. And I will tell you, I was very far away from my parents as they were aging. And it was a very stressful time. Because you want to be there, and you want to know what's going on.
Absolutely. I think that's it's kind of the irony of a lot of times people think, oh, well, it's easier on the people that are farther away. I think it's just the opposite, to tell you the truth. I know sometimes you feel like, oh, a lot of the responsibility gets placed on the person that's closer by, but I think sometimes we overlook the challenges and the stress that can be placed on the people that actually are more long distance caregivers. And I don't think we pay enough attention to that sometimes.
What I give, I feel, is peace of mind to people who are far away and to the client themselves. They know now what's going on. They know they don't have to do it alone. There's somebody that they can call whenever they want.
Tell us, Can you give like some, obviously without disclosing her personal information for people, which you wouldn't do, but can you give us some like scenarios, like of so that people can see like, geez, this applies to me, or you know what I mean? That could kind of just shed some light for people on, wow, this might be something that just would be really the right thing.
Recently, I had a lovely couple that both of them were my clients. I was contacted by the son and said, you know, I know mom's not doing well. I know dad's not doing well. Mom used to take care of dad. He needs someone to take care of him. She's too ill to do that.
Yeah.
Can you help us? Yeah. It was the most rewarding thing for me to take them from a place of real hardship to a place where they are no longer falling through the medical cracks.
Yeah.
I was able to take the burden off the wife, and for the husband, within about a 2 to 3 week time, I had services coming to the home for him. I had contacted his doctors, who were thrilled. They said, well, we talked to him about what to do, but nobody's with him, and he doesn't remember.
Oh, sure.
So it was a win-win-win all around.
Yeah. Well, that's the thing, too, is that, you know, sometimes you're getting that information, people will get an information of what they should do, but they're immobilized because even though they have that information of what might be helpful, they can't implement it. You know, so it sounds like it's multi-layered in terms of what can be done, not just given information, oh, this is what you should do. It's now that you're going to that next step and saying, you know what, let me help you to get this stuff in place, too. And because if you're not in the system, it's hard to know what's out there.
I was so amazed. This gentleman was also a veteran, and I called the VA, and I could not believe what was available to him, but no one had asked for yet.
Oh, yeah. Yep.
And things just started to fall into place very quickly. Wow. And he was thrilled.
Yeah. People don't know what to ask for. And I truly feel like I've seen it so many times is that, you know, people feel like there's nothing out there because they haven't heard of it until then all of a sudden you start digging and there's more out there than you know.
Well, that was one of the reasons I really wanted to do this as an advocate, because as a physician, I saw here was the resources, here was the need, and they didn't know about each other.
Yeah.
And so I like making that connection.
Sure. So, you know, and you've been in the system as a physician in that way too, where you have run up against some of the obstacles that healthcare shows us, right? And because you're definitely a people person, you know, so what is this like for you, Donna, in terms of like really being able to, because a lot of times I think some of the physicians out there would love to have more of the connections doing this thing, but that's not how healthcare works. What has this been like for you to be able to do this on a whole different level?
And you are so right. Physicians would love to spend more time and really get to know you and put things in place for you.
Yeah.
The system right now is broken.
Yeah.
It's really hard for them, even if they have the best of intentions.
Yeah.
So this has been a dream come true.
Yeah.
Like I said, I've done this for 30 years on the side, just very informally.
Yeah.
But to see the look on people's faces when they've had an issue they didn't know how to solve, and I solve it for them, it's pure joy for me. Pure joy.
Sure. Oh, I bet. Because, you know, it's such a helpless feeling for people, but to know that that's the wonderful part about this business, right? And knowing that you've made a difference in somebody else's life, and you know, because when you see people out there flailing about, and it's just so awful to watch. But then again, feeling like there's nothing, there's no help, how isolating it is for people. And you help them to know that there is stuff, there are connections to be made.
And so many times, individuals do not need a lot of help.
Yeah.
They just need a specific type of help.
Yeah.
Once they have that, they're good again.
Yeah. Yeah, it's great. Do you have other situations, again, that you can describe, like scenarios that people are, where they would reach out to you in that way?
I can think of two, actually.
Okay.
One was a mom with a young child, probably 6 months old, and she was sitting next to me at an award ceremony for little children, where everybody gets an award. Her baby cried through the whole ceremony. And at the end, I said to her, "Oh, is your baby very tired?" And she had just immigrated to the U.S., and she said, "No, not tired, sick."
Oh.
And I said, "Well, you should take your baby to the doctor." And she said, "I did, and they wanted to hospitalize him. And I said no. And so she described to me in broken English, but I could understand her, but it took some time. Time you might not have in the doctor's office.
Sure.
And she said that this 6-month-old baby had ulcers down its throat.
Oh, wow.
It couldn't sleep, it couldn't eat. It was in pain. And so the whole household was not sleeping.
Sure.
I said, okay, how about we just go to the pharmacy? Because I knew as a physician, oftentimes I would anesthetize the throat for a child if we're doing some procedure. And pharmacists are a wealth of knowledge. I went to the pharmacy with this woman. I explained to him what was going on. He came down and he showed her some medication to give the baby and how to apply it.
Wow.
I called her up the next day. I said, well, how are things going? She said, oh, first night's sleep in 3 nights.
Oh, wow. Wow. So, and again, she wouldn't have thought to, all I have to do is go to a pharmacist and see if they can help me in this way.
Exactly.
It's just, people just aren't thinking. What was the other situation you were going to describe?
Well, the other situation was someone whose dad had taken a turn for the worse. He had just been hospitalized. It was very unexpected, and things were changing minute by minute. And the family said, we cannot handle this. There's too many moving pieces. We are too unfamiliar with the healthcare system. They were giving us all these options. We don't know what to do. Could you help? And I could.
Wow.
I could.
That is great. You know what we do. We work, and I know it's helpful too to have people like you, advocates out there, so that people are afraid sometimes. They don't understand end-of-life care. They don't understand hospice care, palliative care. And I often like when people get connected up with other resources too that have that information so that they can help, because they might not even know enough to call us because they're thinking, no, this isn't what time it is. But you're seeing people at all different levels or stages of health and of life, and it's something too that you can educate them about. Because it sounds to me you're doing all kinds of interventions, but education is a big piece as well.
That's a huge piece for me, because again, if you have information really is power. Then you can make a decision that you can feel comfortable with when you know what the options are.
Absolutely. Well, education was getting that woman to connect with the pharmacist. Something, again, you would think that, well, wouldn't anybody? No, they wouldn't know that. So I'll tell you, it's just amazing how these small steps can make such big differences. So, so tell me other things that I want to make sure I cover everything for you in terms of, there are other things that I haven't asked you about, this that you want people to understand too.
I think I'd like people to understand the value of an advocate. In so many, it's not just for the client, even though we do help mostly with them. It's not just for the family. The physicians benefit too. And they're just learning this. We'll come with the client to the appointment. We'll have the list of questions. We'll have the patient prepped for what things to ask. The appointment goes much smoother. And then they don't get the calls afterwards because we were there taking notes.
Right, exactly. Are you getting good feedback from the physicians at these visits?
I am. But it also helps. I've worked with a lot of elder attorneys, and they know their clients are being taken care of.
Yeah, absolutely.
And the hospitals, they're just starting to understand what an advocate can do. But we're there, we're a second set of eyes, and right now, medical error, I'm sure you know this, is the third leading cause of death. And having someone else there, checking the meds before the patient's going home, watching over the patient, is just helpful. Knowing when the patient has changed because they just happen to mention something to me.
Yes, yeah. And you're working with people, it sounds like, over a period of time where you can see some of these subtle changes too in people, and not so subtle sometimes in terms of when people are having health issues or other things going on.
Sometimes a child cannot say to the parent, I see this in you. You really, Mom, need to do this. Where as an outside third party, I can say, you've never talked to me like this before. You were always very nice, but today you don't seem to be yourself. are you depressed? Is something going on?
Yep.
And they will tell me.
Wow, that's great. Yeah. Well, they're given the opportunity. Do you have, so how can people reach you?
2 ways. They can give me a call on my cell phone,
Okay.
which is 978-412-6532,
Okay.
or connect with me on my website, which is simply Alongside Medical Ally.
Excellent, and we're putting that up on the screen right now, Donna, so that people can see this, which is great, so that they can get a hold of you if they have further questions about this, or even if they think this is for me, you know. If you're gonna, I want you to also say, if there's one gem that you want to kind of impart to people. And I want to make sure again, because, like I said, I have a lot of questions about this that I got to ask you today, but I'm sure there's much more, too, that you could share with us. What would you want to tell to the audience, as we start to wrap up today?
What I'd like to tell them is that there's such a value of having a healthcare advocate, and a huge part of that value is you don't have to do this alone. And having an advocate by your side brings peace of mind.
Yeah.
And that could be a huge part of your healing.
Yeah, I do. I think people feel very isolated, and very overwhelmed. And so I could see where this would be just such a huge benefit for them. Yeah.
And I'm happy to do it.
Well, it's such a pleasure. I can't tell you to have you on the show and to
you.
hear more about what you do. I'm very I've always been impressed by you, Donna, but this is it's so wonderful to get to understand more about what you do.
Thank you.
This is really just it's invaluable what you offer. So thank you so much for being here today.
Thank you for having me.
Oh, sure. And if people have questions also that they want to send to Care Dimensions, please feel free. We're putting the contact information up on the screen now, and people can reach us at the phone or the email if they have any questions. But I want to thank everybody for tuning in today to Timing is Everything, and look forward to seeing you at our next show.
Care Dimensions, formerly Hospice of the North Shore in Greater Boston, is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most.
So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.